Chapter 9 in our Phlebotomy textbook covers complications that can occur during venipuncture and variables that you may encounter. You should be aware of your surroundings and the patient condition so that you can make changes or adjustments to your routine practices to ensure the safety of the patient and yourself, as well as collect an acceptable sample. There are complications that can occur during routine venipuncture. There could be errors on the requisition form or a temporary ID for unknown patients. The patients may not have an available area to draw blood from. Identification errors can lead to transfusion reactions, wrong medications being given, or misdiagnosis. Patients in the emergency room, ICU, or who have substantial injury may not have a good site to access for venipuncture. Many issues can occur during collection, especially if the patient is not cooperative. The emergency department may have different procedures for lab orders. They might be written or called to the lab. There should be procedures in place. The required patient identification should always be included on samples, usually first and last name, date of birth, phlebotomist, initials, date, and time of collection. If you have a sleeping patient, you must gently awaken a patient, let them become oriented, and verify their identification before attempting a venipuncture. A patient who is unconscious should still be greeted, and nursing staff may assist with holding the arm in case the patient may move. A psychiatric nurse may assist you with psychiatric patients who may be more anxious. If a doctor or clergy member is with the patient, you may need to come back unless the request is for a timed or stat order. Then you should explain to the visitor that you need to collect the blood. If visitors are present, you should greet them and give them the opportunity to leave. If a patient is not available, you should contact nursing staff to locate them. In long-term care facilities, be sure to check for restrictions. If you collect samples at a home, these should be scheduled, pets should be put away, and you should not enter without permission. If the patient's ID band is not on the patient, you must request that the nursing staff band the patient. Hospitals will have procedures for patients who don't have ID. You should follow those procedures. If the patient is a child or is not able to identify themselves, you should ask a parent, family member, or nurse to verify the ID on the band. Hospitals have procedures to provide a translator if the patient does not speak English. The basal state is the ideal time to collect blood from a patient. This is usually early in the morning when the patient has not exercised or eaten. These results can be compared to normal ranges to determine the patient's condition. There are factors that can affect a patient's lab results. When a lab test can be affected by these factors, patients are usually given instructions about what to avoid. A good example is fasting for glucose or a lipid panel. When you have an order for fasting glucose or a lipid panel, it's important to ask the patient if they are fasting. If the patient is not fasting, then this should be noted in their record. When an infant is stressed and crying violently, this can cause an elevation of the white blood cell count. People who live at higher altitudes will increase their blood counts to compensate for the lower levels of oxygen. It is important to realize that laboratory normal values may vary between the sexes and between people of different ages. During pregnancy, the overall volume of blood increases. This means there is more plasma, and this has a dilutional effect. Hemoglobin concentration is usually lower, which contributes to the patient feeling more tired. There is a diurnal rhythm, that is a normal fluctuation in blood levels at different times of the day based on a 24-hour cycle of eating, sleeping, activity, darkness, and daylight. Therefore, it is important to collect some samples at specific times of the day. Administration of medication before specimen collection may affect test results either by changing a metabolic process within the patient or by interfering with the test procedure. Injection of radiographic contrast media or dyes is one example. This is why doctors will ask patients what medications they are taking, even the over-the-counter medications. People who take aspirin or anticoagulants will take longer to clot, and additional pressure must be applied for a longer amount of time after collection to stop the bleeding. The needle should be removed. And you should make an effort to prevent the patient from falling out of the chair. So you've removed the needle and you've activated the safety device. You may have to remove the tourniquet after this type of emergency. It is important to keep the patient from fainting, and if they do faint, it is important to keep them in the chair so that they don't fall on the floor. Seizures are rare, but you must protect the patient from injury as best you can. Seizures must be reported to the physician, and medical personnel must evaluate the patient before they are allowed to leave. If the patient has petechiae on their skin, you may need to apply additional pressure for a longer period of time after venipuncture to stop the bleeding. If a patient has an allergy, it is important not to use equipment that has this allergen. Latex and iodine are allergens to be concerned about. Most hospitals do not have latex products in the facility. If you do have latex equipment, you should know what it is and not to use it with people with that allergy. If a patient feels nauseated, remove the needle and activate the safety device. Provide the patient with something to vomit in, even if it is just a garbage can. Be alert to changes in the patient. Keep the patient talking so you can tell if they are alert throughout the procedure. Patients have the right to refuse treatment. Never collect blood from someone who is not willing. You should report that the patient declined in the order and follow facility policies. If your tube loses vacuum because you pushed it in too soon, or if you pulled the needle out, you will need to be able to reach another tube to replace this one. Expired tubes can also lose their vacuum. Your equipment should be accessible so that your equipment should be accessible to you, but not to a patient who is in psychosis. If a patient has sensitive skin, you may need to apply the tourniquet over clothing to prevent injury. A blood pressure cuff can also be used when the vein is difficult to find. If the tourniquet is left on longer than 1 minute, then hemoconcentration and hemolysis can occur. Hemoconcentration can also occur if drawing from a sclerosed vein, an edematous site, or vigorous fist pumping. This should be avoided, or lab values can be erroneous. When veins are not easily located, it is important to always check the other arm first before trying the hand. Massage, gravity, and heat can improve locating a good location. You should not collect blood from a leg or foot vein without permission from a physician. You should avoid collecting blood above an IV where there is decreased blood flow or in an area with infection, or from veins that are occluded or sclerosed, as the sample will be contaminated or you won't get a sample at all. Avoid collecting blood from an area with a hematoma, edema, burns, scars, or fresh tattoos. You may collect blood from the area below a hematoma. Because patients with mastectomies have their lymph nodes removed, applying the tourniquet can cause the patient to develop lymphedema or an infection. The sample could also be affected by lymphostasis. You must use the other arm. When a patient is overweight, it may be more difficult to locate a vein. Some people may prefer a syringe, and the cephalic vein may be the best choice. If you collect blood above an IV, the sample will be diluted with the IV fluid. You must collect below an IV or from the other arm. Only nursing staff can collect from a heparin lock. As a phlebotomist, you should not touch them. Patients who undergo renal dialysis will have a fistula that is used for the procedure. You must avoid drawing blood from the arm with the fistula, which looks like a large pipe under the skin. Usually the patient will let you know about this. Isopropyl alcohol is used for routine venipuncture but must not be used for collecting samples for blood alcohol levels. Chlorhexidine or providone iodine might be used for collecting blood culture samples. Before using a syringe, you should pull the plunger back and then push it completely back in. Otherwise, it is too difficult to draw the blood. A syringe can be used for fragile veins that can't withstand the pressure from the evacuated tube system. A transfer device can be attached to the transfer blood from the a transfer device can be attached to transfer the blood to the vacuum tubes after you remove the needle. The syringe, needle, and transfer device should be disposed of in the sharps container. So you can see the syringe being inserted in the first picture. Then you can see the plunger being pulled back to let the blood flow in. And then the third one, you see them activating the safety device. Please note that most locations do not want you to activate the safety device with your fingers. They wish you to use a hard surface like a counter. The needle with the safety device has been removed and disposed of. The transfer device is attached and the tubes inserted into the transfer device. So here is the transfer device. Here is the blood being transferred into the tube. And then here is the syringe and the transfer device being disposed of in the sharps container. And lastly, here is the arm being wrapped. The winged blood collection set is also known as the butterfly. It is inserted at a 10 to 15 degree angle and is ideal for small fragile veins. It can be used with a syringe or an activated tube system. You must have a discard tube that can be used to remove the air from the tubing so it doesn't affect the volume of your next tube. The wing collection set is meant to be held by the wings, not the tubing. So we can see this. She's going to apply the tourniquet, select the vein, clean the site, release the tourniquet. Shows the tourniquets back on, insert the needle at 10 to 15 degrees, draw the blood into the syringe, release the tourniquet, remove the needle, and have the patient hold pressure. Activate the safety device and dispose of the needle. There are several reasons why you might not get blood. The needle's position may need to be adjusted. If the bevel of the needle is against the vein's wall, blood will not flow. You could be too shallow or too deep, and a slight adjustment may start the blood flowing. A vein may collapse if there is too much pressure from a large gauge needle or a large vacuum tube. Pulling back too hard on a syringe can also collapse a vein. Missing the vein, of course, will cause you not to get blood. If you think you are in the vein, try a new tube in case the other one is faulty. Do not make more than 2 attempts. Section A shows the correct setting. Section B shows the bevel of the needle pressed against the wall of the vein. Section C shows the needle too deep and against the bottom of the vein. Section D shows the needle rotated, which is more difficult to do with since the safety device is up, and we'll show you that it's in the right place. Section E shows the needle through the bottom of the vein, so it's too deep. Section F shows a hematoma forming. Both E and D can be corrected by slightly pulling the needle back till blood starts to flow. When a hematoma starts to form, sometimes it swells up quickly and you should pop the tourniquet and remove the needle, then apply pressure till the bleeding stops. When staff tries to find a vein with blind probing, excessive manipulation, or going in too far, or the patient moves or jerks, or you collect blood under the wrist, you may hit a nerve which can cause pain or nerve damage. You should remove the needle as soon as possible and provide first aid. It is best to avoid nicking the nerve. If blood is collected too frequently or more than needed, this can cause anemia in some patients, called iatrogenic anemia. Premature infants will need blood transfusions to replace the blood collected for testing. This slide shows some things that can cause hemolysis: using a large vacuum tube with a small gauge needle, not letting alcohol dry, pulling a syringe plunger back too hard, pushing blood from a syringe into a vacuum tube. Most tubes that have hemolysis are due to poor phlebotomy technique, and a new sample must be collected. A hematoma can form due to keeping the tourniquet on too long. If the patient bends their arm instead of holding pressure after collection, probing around for a vein, too large of a needle, or an arterial puncture. Older patients are prone to bruising even when phlebotomy is performed properly. Always check the ID band and ask the patient their name and date of birth. The information from the patient must match the requisition form. Portable label printers can print the correct labels. Remember, the improper identification can cause the death of a patient. Always maintain pressure or have a capable person apply pressure while you label the tubes. If the patient is incapable, you should apply pressure and apply Coban. Do not cut off the patient's circulation by wrapping it too tight. Some people will have a reaction to Band-Aid adhesive, and you should use paper tape or Coban wrap. If blood is bright red or comes out way faster than expected, you may have accidentally done an arterial puncture. This vessel will have a pulse. If this happens, then discontinue the collection and apply pressure for 5 to 10 minutes, and then apply a pressure bandage. You should notify nursing staff if that occurred. When leaving an inpatient's room, make sure that you have not left supplies behind. Make sure the bed rails are up. Make sure the table is within reach of the patient. Notify nursing staff if a patient asks for food or water. There are many reasons that a sample will be rejected. If it is not labeled properly, if the sample is inadequate, the wrong tube type was collected, hemolysis, clots, transported at the wrong temperature, no order, contamination, delay in processing. Lipemia can cause problems with testing, but the phlebotomist cannot do anything to prevent this.